Looseness of the vagina is a very common problem faced by women, and a lot of women are very inhibited to talk about it, and they feel that they are the only one who face this problem. It is not so. So let us understand in this video what laxity of vagina is all about and how do we treat it. I am Dr. Shilpi Bhadani. I am a plastic and aesthetic surgeon at SB Aesthetics, Gurgaon, India. So let's first understand what can be the symptoms of a loose vagina. The first one, the most common problem that women will tell me in the consultations when they come to consult for this is the lack of satisfaction in the sexual intercourse and also physical discomfort. So basically, when we try to understand, the vagina is really like a tube, and it has a capacity of expansion and then it comes back to its original shape. But then when we are talking about normal delivery, for example, in that what happens is that the vagina expands, but a lot of time it does not come back to its normal position, and that is why there is residual laxity after the normal delivery process, which is one of the main reasons of a loose vagina. Now, the second symptom that women face with a loose vagina is urinary incontinence. So, incontinence can simply be understood like urine leakage while coughing, while laughing, while dancing, while exercising, and it is a very common problem. So, these are the two main problems, the dissatisfaction in sexual intercourse and the urinary leakage that one may face with a loose vagina. The first reason for the loose vagina we understood was normal delivery. Now, what can be the other important reasons? So, aging is another common reason of vaginal laxity. So, like we age and we become loose in other parts of the body, so the vaginal tissues also become lax. So, it's not only the vaginal mucosa, but also the area surrounding that become loose while we age. So, obviously, that also has an important effect in the laxity of the vagina. Now, the third important cause can be a chronic ailment, like when you cough chronically due to some reason, or when you are chronically constipated and you are exerting pressure while passing stool. So, that can also be one of the reasons when the vagina becomes lax. The other important cause is your lifestyle. So, if you gain and lose weight very frequently, then also the tissues go under a process of expansion and deflation, and that kind of makes them lose their elasticity. So, that is also one of the reasons. Smoking is another important cause. So, like smoking affects the other areas of the body, so it also affects the vagina. So, these are the important causes of vaginal laxity. Now, when we come to understand what can be done, number one, to prevent it. So, first thing is that if we are conscious enough to prevent the vaginal laxity, a lot can be done even without any procedures. So, let's say one has had a normal delivery or one is in their mid-30s, 40s. That is the right time when you can start Kegels exercises. This is a very important exercise that one can do on a regular basis to keep their vagina tight and the pelvic muscles tight. So, basically it's about squeezing your anal area and then holding it for a maybe count of 30 and then relaxing it again. This, when done thrice daily over a period of months, you will start realizing that you are gaining back that strength in your pelvic musculature and thereby tightening the vagina as well. Now, a lot of times females will come to me and say that, doctor, it's already loose now, what do we do? So, then comes the question of how loose it is. Let's say that you're facing early laxity, then even Kegels exercises can come into play and you can achieve a remarkable difference over a course of a few months. Lasers also are an important alternative when we are talking about treating early looseness of the vagina. So, we have a lot of advanced devices like radio frequency or lasers that can deliver the heat and then tighten by generating collagen. So, these are the preventive or curative in the early stages. But let's say that one has a very loose vagina already, then we also have a surgical option for tightening the vagina. In this, it's a surgery, can be done under spinal anesthesia or general anesthesia. It's a daycare procedure and we can take out the extra mucosa of the vaginal wall. So basically the vagina has expanded, so obviously there is extra tissue that has been generated, and we can take away that extra mucosa and we can tighten the muscles inside, thereby making the lax vagina tight. Obviously, there are certain precautions that you will be needing to take after the surgery. We've made a video on vaginal rejuvenation. You can watch that video as well. We'll provide the link in the description box below. Through this video, I just wanted to give you an overview as to what the causes and the cure can be for a loose vagina. Vaginal tightening surgery is an important part of mommy makeover surgery. We've posted several videos on mommy makeover and we'll keep posting such interesting information. You can subscribe to our channel for this. SB Aesthetics is the name of our channel, and you can keep the notification bell on so that you get the updates for the new videos.